our last testimony, our last panelist is Sonya Tetnowski from sunny California. So Sonya, you're up virtually.
Thank you. Good afternoon. My name is Sonya Tetnowski. I'm a citizen of the Makah tribe, president of the National Council of Urban Indian Health, and chief executive officer of the Indian Health Center of Santa Clara Valley. I also serve as the chair of the health subcommittee within VA's first ever advisory committee on tribal and Indian affairs. We're grateful to you, Chairman Tester, and to Senator Sullivan for your partnership on the VA Tribal Advisory Committee Act of 2020. I'm sharing my views here today as the president of NACUI and not in my capacity as on the advisory committee to remain in compliance with Federal Advisory Committee Act. As a U.S. Army veteran and as an urban Indian organization leader, it is imperative that our physical, mental, and cultural needs are addressed in a culturally competent way. As you know, 67% of Native veterans live in urban areas, and more than 50% use Indian healthcare providers. We need the ability to go to a facility that understands, respects, and recognizes our unique needs. Urban Indian organizations provide a wide range of health and wellness services. In fact, we currently serve 7 of the 10 metropolitan areas with the largest Native veteran population. Therefore, it is critical that VHA work with us to improve the health outcomes of Native veterans across the ITU system of care. Since more than 50% of Native veterans use the ITU system for their healthcare needs, securing advanced appropriations for the Indian Health Service is critical. Gaps in federal funding put lives at risk. In fact, 5 patients died during the last shutdown. The risk is too big and the price is too high for us to continue without advanced appropriations. When the VHA received advanced appropriations, the president said, "The care that our veterans receive should never be hindered by budget delays. Yet, we have not protected our Native veterans who receive care from our ITU system." During the last government shutdown, my clinic supported another urban program so that they could remain open. This should not be happening to our patients and specifically to our veterans. All this due to funding delays caused by the shutdown. Therefore, I urge this committee to help secure stable funding for all Native veterans by supporting advanced appropriations for IHS. It's been about 2 years since we worked with you both, Chairman Tester and Ranking Member Moran, on the PACT Act to remove co-payments for Native veterans receiving VA health care. In September, VA committed to putting this legislation into effect and eliminating co-pays for Native veterans by the end of this year. But it needs to go one step further. We ask this committee to encourage the VA to allow self-attestation in determining Native identity for VA co-payment purposes, because many Native veterans may not have the kind of ID that defines them as Indian or urban Indian. NACUI advocated for years, and I testified many times for the inclusion of urban Indian organizations in the VA reimbursement program. We're grateful to this committee for fixing this parity issue. However, many urban programs are experiencing difficulty enrolling, and only 1 of 41 completed the process. We need additional technical assistance and the ability to modify these agreements so that they work within the scope of services of our respective sites. I'd like to thank the VA for working with urban Indian health programs, but an urban confer policy between VA and our clinics would solidify this relationship. During the rollout of COVID-19 vaccines, some veterans who went to the VA received vaccines and were told to go back to their Indian clinic. This highlights the need for greater coordination among all entities serving our Native veterans. In June, the Health Equity and Accountability Act was introduced with the first ever legislative text establishing urban confer policy with the VA. We would love to see this committee include language in future packages related to Native health care. In conclusion, Native people have a long history of distinguished service to this country, and we owe it to them to address these issues and remove these barriers to ensure greater access to care Thank you for allowing me to speak on these critical issues affecting Native veterans. My full testimony was submitted for the record, and I'm happy to answer any questions. Thank you.